Hello and welcome to September's WorkRite webinar. I'm Chris Jones, Technical Director at Posturite, and today we are talking about our course OHSA, or OHSA rather, which stands for Office Health and Safety Awareness. I'm joined by my trusty partner Ellie Hale. Ellie, how are you today?
Yep, super. Thanks, Chris.
Good stuff.
Hooray.
Excellent. Well, over to you, Ellie.
Okay, so basically what I'm going to do today is just take you through the course and show you each of the segments that we deal with on the course. I get asked a lot by clients when I'm talking about WorkRite, have we got anything that's suitable for induction? And lots of our clients use this course as their induction process. So as we go through, as with all of our courses, you're able to tweak bits, change bits, add extra slides in, and can make it specific to your organization. So without further ado, I'm just going to talk you through it. So health and safety in the workplace is governed by a number of regulations covering a range of specific workplace hazards and risks. Many of these regulations stem from the primary piece of occupational health and safety law, the Health and Safety at Work Act 1974, which I think we're all familiar with. Your employer has a duty to protect your health and safety and keep you informed about health and safety matters in the workplace. You have a responsibility to look after yourself and others and abide by any health and safety procedures and policies that have been put in place by your employer. It goes on to define health and safety, health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity, and safety defined as the freedom from unacceptable risk of harm. In almost all workplaces, there are likely to be a number of hazards that may put people at risk. The nature of the hazards and the level of risk will very much depend on the type of work and the equipment being used, as well as the general attitude to health and safety. And again, if you wanted to add at this point some specifics to your company or include some hyperlinks to HR policies or something, that's something we'd also be able to do for you. Health and safety is affected by tasks being carried out, the environmental conditions and human factors. It's therefore important that workplace hazards and risks are controlled under legislation using detailed health and safety policies and procedures, risk assessments, and suitable staff training. This course will introduce you to the following areas where health and safety procedures are required to control risk and reduce work-related ill health. And then it's going to take you through the sections. At the end of this health and safety awareness course, you should have an understanding of the health and safety issues present at work. You should also be aware of your responsibility and that of your employer to minimize risk and to ensure the health and safety and well-being of yourself and those around you. So we have a separate course called AssessRite, which I've taken you through before for DSE, which has the DSE training, a test, and then a self-assessment. This bit's just going over it in brief for you guys to cover an element of training in the induction process. So at work and in everyday life, you'll be put under a certain amount of pressure and strain, most of which your body will be able to cope with and recover from during times of rest. For instance, when not at work or when sleeping. When the demands on the body become too great, it's possible that work-related musculoskeletal disorders can result. Work-related musculoskeletal disorders are musculoskeletal injuries to do with muscles, joints, or bones that are made worse by work or the work environment. It can cause severe and debilitating symptoms such as numbness, tingling in fingers, pain in the lower back, restriction of joint movement, and soft tissue swelling. It can be caused by a number of different factors, many of which are as a result of sitting for long periods at your workstation and failing to organize your workday to include frequent breaks and changes of activity. Other causes include forceful movements, prolonged use of hands, frequent or heavy lifting, pushing or pulling, or prolonged awkward postures. There are many ways to reduce the likelihood, such as ergonomic task design, risk assessment, and suitable selection of work tools. Other prevention methods include planning your work so there are breaks and changes in activity, early reporting of any aches and pains, using work equipment as it is intended to be used, carrying out work tasks in a safe and sensible manner, and reporting any faulty or broken work equipment. Musculoskeletal disorders and stress are often closely related, and if someone has a musculoskeletal disorder, they're quite likely to experience symptoms of stress and vice versa. It's important to plan your day to include regular breaks and changes of activity, and report any aches or pains at the earliest opportunity. And here, if you were going to bespoke it to your company, you could include some details about a breakout area that you've got. I've got a client that likes to include information about a free Pilates class they offer on a Friday morning. You can do whatever you want with it, really. So now we're going to go through to working with computers, the display screen equipment. Poorly designed workstations and work organization may also lead to musculoskeletal disorders causing aches, pains, swelling, and poor performance. It's accepted that there are risks associated with working at computers. As part of your employer's responsibility, training and a risk assessment of your workstation should be carried out within the first few weeks of your employment. Training in the safe use of display screen equipment and a suitable assessment of your workstation is necessary, not only to stop the occurrence, but also to protect you from other risks associated with your workstation. Although there's no evidence to suggest that working with DSE damages your eyes or eyesight, it may cause short-term effects such as blurred vision, sore stinging eyes, dry eyes, or headaches, which I've definitely had if I've been working at the computer too long. Poor software design, unsuitable software for task, or insufficient training regarding the use of software can also lead to stress. The aim of the workstation risk assessment is to highlight any potential hazards in the following areas: your chair and desk, so the size, height, suitability, adjustability, posture, and display screen characteristics, and input devices. And your work environment, so lighting, temperature, humidity, noise, work breaks, changes of activity and training. If you have not yet received this training or undergone a workstation risk assessment and used display screen equipment as a significant part of your work, please contact your manager. Now we're going on to slip, strips and falls. So this whole course is based for an office environment, so a low-risk environment. Slip, strips and falls can happen in any type of work environment. According to figures in the UK, one slip or trip accident occurs every 3 minutes, and it's these type of accidents that account for 33% of all reported injuries. That's a pretty high figure. The following list comprises of some of the factors that increase the risk of slips, trips and falls. So footwear, people's behavior, environmental conditions, obstructions, type of floor surface, standing on unstable or unsuitable objects such as using chairs instead of step ladders or proper footstools, poor lighting in corridors or stairways. With footwear, here for example, we're not allowed to wear flip-flops. Wearing flip-flops.
You are wearing flip-flops, Ellie. I just a moment's pause while I noticed. But fortunately, in our main building where the hazard is there.
No,
but,
not at all.
Don't go in the warehouse.
I won't. I'm not allowed in the warehouse at all. Appropriate footwear, here we go, can play an important part of preventing slips, trips and falls in the workplace. Think about the type of work tasks you carry out and the environment in which you work. Is your footwear likely to put you at risk of harm? High heels can increase the chances of somebody slipping or tripping. And the way people behave and act in their work environment can increase the likelihood of slips, trips and falls, like carrying too many files or boxes so you can't see where you're walking, or rushing around the workplace are both likely to increase your chances of slipping or tripping. Obstructions as a result of bad housekeeping are a commonplace cause of trip accidents within the workplace. If you spot a potential slip, trip hazard, then that hazard should be removed or highlighted and reported immediately. And again, if you wanted to put specifics on what that procedure is, how your staff should go about it. In the office environment, there's little reason why you should There is little reason why you should need to work at height. If you are required to access something up high or out of reach, be sure to ask for assistance or use the equipment that's been provided, for example, a kickstool or a step ladder. So, this module has highlighted some of the issues. Slips and trips are a major cause of accidents at work. Floors and stairways should be well maintained and have adequate lighting. Suitable footwear should be worn, and good housekeeping is one of the most effective ways to reduce the risks of these type of accidents. Now we're going on to electrical safety. Every year there are numerous injuries caused by electrical shock or electrical burns at work, and the figure is very similar for electrical accidents in the home. In the office environment, many different types of electrical equipment can be found, from computers and printers to office lighting and kitchen appliances. If not installed correctly and tested routinely, these items may have the potential to cause harm to the people that use them. Primary hazards created by electricity include burns, fires, shock, and explosions. Secondary effects could be falls following an electric shock, loss of information from computer drives, damage to equipment, and deactivation of security systems and control measures within the workplace. Unsafe use or improper modifications can increase the risk of harm when using electrical equipment in the workplace. Unsafe working practices include failure to report faulty equipment, misuse of equipment, modifications and repairs carried out whilst the appliance is live, or modification carried out by somebody who is not competent. Other unsafe working practices are condemned or damaged equipment remaining in use, equipment unsuitable for the working environment in which it's being used, leaving electrical equipment on while away from the office, for example, over the weekend or on holiday, or overloading adapters and foregangs. It's a risk. Pat testing is a method used to routinely test portable appliances to check there are no internal or external faults. Examples of portable devices in the office environment include display screens, printers, mobile phone chargers, computer towers, and extension cables. Only a trained and appointed person can carry out a PAT test. Although it's easy to spot an untested or out-of-date test on a portable appliance, all portable appliances should have a test certificate sticker on them. If you spot this to be out of date, or if the sticker is missing altogether, it should be reported to management. You should perform your own checks prior to using a piece of electrical equipment, so to identify any visible defects, such as loose plugs, damage to wire insulation, damage to appliance casing. Bringing your own electrical appliances into work, such as kettles or heaters, may put you and your fellow colleagues at risk. These items will not have been PAT tested, and most companies prohibit employees from bringing in their own electrical equipment. It's important that electrical equipment is installed and used safely in the work environment. If a piece of equipment becomes very hot or starts to smell, it's advisable to switch the electricity off at the wall, but this can only be done safely, only if this can be done safely and without personal injury. Remember, seek help in an emergency and do not put yourself or colleagues in a position where you or they could be hurt. And again, if you wanted to mention whoever the person in your company is that's in charge of PAT testing at this stage, you could. Now we're going on to fire safety. Although the fire brigade are called out to fires every day, the risk of a fire occurring in most offices is low, as long as everyone is fire safety aware. So this module is explaining the requirement for you to attend or complete fire safety training and abide by any emergency procedures that have been put in place for your safety and well-being in the workplace. Employees as well as employers are legally bound to undertake fire safety training. Employers have a responsibility to provide training for employees in fire safety and carry out risk assessments. Training forms part of your initial induction and should be repeated at regular intervals. As an employee, you have your own responsibilities regarding fire safety. You must assist your employer in carrying out their legal requirements. You must undertake any training in respect of fire safety that's offered. You must participate in all drills and exercises. You must be familiar with the location of the nearest fire exits and extinguishers. If you suspect something's wrong, such as a missing fire extinguisher or alarms not working, you must convey this information to the responsible person. It's not just what you do, but also what you don't do. Fire safety measures should already be installed within your building. You are required to know these arrangements. Your awareness and that of your colleagues will help to keep you all safe. Never be afraid to sound the alarm if you suspect a fire. If you genuinely believe there's a problem, you must do something about it. Fires develop rapidly, and the most important thing is for everyone to be safe. Employers are legally obliged to arrange fire alarm testing, if applicable, every week, and carry out fire evacuation drills every 6 months. It's important that any drill is conducted seriously and reviewed to improve effectiveness. In the event of a fire alarm, do respond immediately. Do encourage others, including your visitors, to evacuate. Do close doors as you leave. Do stay at the assembly point. Do obey any instructions issued by a fire warden. In the event of a fire alarm, don't wait to be told what to do. Don't finish your coffee. Don't believe anyone who suggests it's probably a false alarm. Don't use the lift unless it's fire rated. Don't take an extinguisher. Don't go to another part of the building to collect your coat. Don't carry on with your telephone call. Don't re-enter the building unless told it's safe, and don't smoke at the assembly point. This module explains the requirement for you to undertake fire safety training as part of your induction. And also here, if you wanted to put specifics again about meeting points or who to contact with regards to fire safety, you would absolutely be able to do that. Now we're going on to manual handling. In the UK, almost 1/3 of all reportable accidents result from manual handling activities. Almost all workplaces will have work tasks which involve some form of manual handling or handling of substances that have the potential to cause harm. This module is going to touch on those. So manual handling describes any tasks that require the body to lift, carry, push or pull a load. If your job entails manual handling, such as lifting boxes of photocopy paper or post bags or water bottles, your employer is required to provide you with relevant training with regard to the type of work tasks you are to carry out. Employees have the responsibility to follow information and training that has been provided by their employer regarding manual handling and must not do anything that would put themselves or others in harm. A range of injuries could result from poor manual handling, such as ruptured discs, sprained ligaments, sprained and inflamed tendons, muscular injuries, trapped nerves, fractures, and cuts and abrasions on the body if a load is dropped. Sounds awful. In order to reduce the chance of injury, manual handling should be avoided wherever possible. If it can't be avoided, an assessment must be carried out, and the handling task made safer by suitable control measures such as using a trolley or appropriate training, reducing the weight and size of the load, or asking for assistance when lifting. So the best method, we're going on to COSH now, the best method of preventing accidents and ill health from hazardous substances is to avoid using or storing them altogether. Where this isn't possible, an assessment must be carried out and appropriate control measures put in place to reduce the risks to an acceptable level. It's rare these days to find hazardous substances in an office environment, but sometimes cleaning materials are stored on site. Any such materials must be locked away when not in use. It's important that any relevant safety data sheets are also held on site in case of any accidental exposure. This is the responsibility of your employer. If you believe you're handling hazardous substances as part of your work and haven't been provided with suitable training or personal protective equipment, please raise this issue with your manager. So, this module has touched briefly on manual handling and the handling of hazardous substances. Best practice dictates to avoid both in the first instance, however, it's not always possible. Remember, if you don't feel adequately trained in manual handling or the handling of substances, please contact your manager. Do not put yourself or those around you at risk and always follow safety instructions. Now we're going on to welfare. Under the Health and Safety at Work Act 1974, employers have got a duty to look after the health, safety and welfare of employees. Welfare is not just about health and safety. It's about a person's well-being at work. Welfare includes providing facilities such as first aid provisions, adequate number of toilets, drinking water, washing facilities, suitable areas for staff for work breaks, and suitable rest facilities for pregnant women and nursing mums. Smoking is a cause of air pollution and not only has harmful effects on smokers but also non-smokers. If you are a smoker, make sure you abide with the health and safety procedures and rules that have been put in place by your organisation. No smoking is permitted within any building, so if you wanted to put the places where on your premises staff could smoke, you could, or if you were banning it altogether. You must not work under the influence of drugs or alcohol. If you're given medication by your doctor, please check it's suitable for you to take whilst you're working. If not, you must inform your line manager. Violence at work also has the potential to cause stress among those affected. Violence at work is defined as any incident in which a person is abused, threatened or assaulted in circumstances related to their work. Violence at work could stem from bullying by fellow work colleagues or confrontations with members of the public. It may have a relationship to the type of work tasks being performed or the kind of environment that you're working in. If you believe you're being threatened in the workplace or experiencing any kind of physical or verbal abuse, it's in your best interest to report this to your line manager or occupational health advisor as soon as possible. Pressure is present in almost all types of work and helps keep us motivated, but too much pressure can lead to stress, which affects performance and can make people ill. There can be many factors that contribute to stress. The most common causes in the workplace are excessively high workloads and unrealistic deadlines, insufficient workloads, a lack of control over work activities, poor working relationships between management and staff, insufficient training for the job, bullying or harassment from management or fellow colleagues, a poor physical working environment, so maybe it's too hot, too cold, or too noisy, unsuitable software for the task being carried out. Stress isn't easy to spot. It's easy to prevent, however. If you think you are suffering from stress, try to identify and tackle the underlying causes. Inform your manager or fellow colleagues so they can understand and work with you to make changes. Improve your diet and cut back where appropriate on smoking, alcohol and caffeine consumption. Take regular exercise. Avoid regularly working long hours if at all possible, and make sure you take holidays. So this module's touched on a range of issues that could affect your welfare in the workplace, as well as the responsibilities of employers. You also have the responsibility for looking after your own health, safety and welfare and those around you when at work. If you feel the need for more information on any of the issues raised, please contact your line manager. Now we're going to talk about particular requirements. So in the workplace, there'll be people of all different shapes and sizes, abilities and strengths. Measures such as risk assessments and training are put in place to accommodate the difference, such as workstation risk assessments and suitable health and safety training. These issues are not, however, the only differences that one will find in the workplace. So some people have other particular requirements in order to carry out their job effectively, like young people, pregnant people, new mums, disabled people, or foreign workers. The requirements of those within these groups will vary from person to person, although it's under the employer's duty of care to ensure the health, safety and welfare of all those people while at work. Young persons are classed as those under the age of 18. The employer has the responsibility of assessing the risks to young workers before they start work, taking into account their age, experience, maturity, their awareness of risk, and their physical build and strength. Risk assessments must also be conducted by the employer for those people who report they're pregnant and also those who are new mums. The employer should assess the risks in the workplace and make changes where necessary. If an employee has a disability, their employer is required to make reasonable adjustments to allow them to work as efficiently and safely as possible. People with disabilities that prevent them from conducting their work tasks without help should be treated on a case-by-case basis. Their employer should conduct a suitable and sufficient assessment of risk and work with the individual to find solutions. Employers are also required to make sure that foreign workers employed in the organisation are provided with appropriate training regarding health and safety matters, and that they fully understand the training and information they receive. We are also able to offer a translation service for any of our courses, if that's something that you guys needed. So there's then a summary of everything that we've learnt about musculoskeletal disorders, working with computers, slips and trips, electrical safety, fire safety, manual handling, welfare, and particular requirements. And then you go on to take the test. I also wanted to show you guys, we have a version of this for line managers also. Bear with me, I just logged myself out. Which is really interesting, as it includes an element of risk assessment. There's a risk assessment module. Bear with me, Chris has got to come and help.
Not quite sure what's happened there, Ellie. Always the way when it's live.
well, if anyone's interested, we have another module which is specifically for line managers, which includes all the information that I've just gone through with you, but there's an element of risk assessment, so how to conduct a risk assessment, what doing a risk assessment actually means, and also about health and safety law, so the legality of being a manager, what does that actually mean, what do you need to be doing for your staff that you're responsible for. So we've adapted this for many, oh, here we go, we're on.
There we go.
Thanks, Chris. We've adapted this for many of our clients. So one of our clients took the OHSA course, but also linked it with our WorkRite course for mobile workers. So there was lots of information about lone working and public transport. They combined two courses together. We've made an OHSA version, which was European and Middle Eastern specific requirements to specific locations for one company. We've got universities that use us and have made it their complete induction for staff, adding in specific slides, pictures, meeting points, and including so many hyperlinks to specific HR policies, which I think is really handy. So here we go, just pointing out the health and safety law, what it means to be a manager. And similarly, risk assessment. Why do you need to do it? How do you prevent accidents? What the 5 key steps are to risk assessment, which I think is really handy. So, I mean, if any of you guys are looking to perhaps give your induction process a revamp, or you are already perhaps a WorkRite client and would like to go through OHSA and discuss what we could do for you, then get in touch. That's me done.
Excellent, Ellie, that was great. And so, without further ado, it's the weekend now. Hopefully the weather is going to be kind to us this weekend. It might be the last of the weather before the summer disappears. So, I hope to see you all next month. Thank you.
Thanks,
Goodbye.
guys. Bye.